Good day everyone, you're welcome to my YouTube channel Everything Medical. On today's video, I will be treating the anatomy of the brachial plexus. The brachial plexus is a plexus of nerve that supplies to the upper limb structures. It is the network of nerves that innervate or supplies to the structures of the upper limb. Those structures could be muscles, they could be skin. It does a whole lot of innervations. It could be motor, it could be sensory innervation. So without wasting much of our time, let's delve into the class. Okay. Now the first thing is the introduction. Introduction. What is brachial plexus? Brachial plexus is simply the network of nerves that supplies to the upper limb structures. It could be supplying to the muscles, or it could be supplying to the skins, thereby providing motor and sensory innervation. So that is all about the introduction of the brachial plexus. Okay. Now, the next we'll be looking on is the root value. The root value. What are the root value of the brachial plexus? The brachial plexus root value includes, start from the C5 to C8 cervical spinal nerve and the first thoracic spinal nerve. So these are the root value. We have the C5, the C6, the C7, the C8, and T1. So we have the C5 to C8 and T1. So that is the root value of the brachial plexus. The next to be discussing is the formation. The formation. What is the formation of the brachial plexus? The brachial plexus is being formed by the anterior or ventral primary rami of the lower 4 cervical spinal nerve, the lower 4 cervical spinal nerve, and the first thoracic spinal nerve. That lower 4 is from C5 to C8. You could see that there are 4. 1, 2, 3, 4. So from the lower 4 cervical spinal nerve from C5 to C8 and the first thoracic spinal nerve. And it has an associated contribution, which is the C4 and the T2. That is the associated contribution of the brachial plexus from C4 and T2. Now, important to note, if the contribution of the C4 is large and that of the T2 is absent, automatically that is called a postfixed brachial plexus. However, if the contribution of the T2 is large and that of the C4 is absent, automatically it is called postfixed brachial plexus. So we have the formation is between the anterior, which is something as ventral primary rami of lower 4 cervical spinal nerves and first thoracic spinal nerve. So the lower 4 cervical spinal nerve is C5 to C8 and first thoracic spinal nerve is the T1. Now its associated contribution is the C4 and the T2 in respect to postfixed and prefixed brachial plexus. So, prefixed brachial plexus, C4 is enlarged or is larged. C4 is large, while T2 is absent. In postfixed, brachial plexus, C4 is absent, while T2 is present. So these are the formation of the brachial plexus. Formation of the brachial plexus. So the next outline that we'll be looking on to is the component. The component. Components of the brachial plexus. The brachial plexus includes the roots, the trunks, the division, cords, and branches. So these are the components of the brachial plexus. The roots and the trunk lies in the neck. They are located in the neck. The division are located behind the clavicle. The cords and the branches, particularly the cords, lie in the axilla. So that is how they are being distributed in the upper limb. You get. The roots and the trunk are located in the neck. The divisions are located behind the clavicle. The cords are located in the axilla. The branches is given off to innervate the muscles and skins in the upper limb. Okay. Now we'll be looking on to the divisions of the brachial plexus according to the relation of the clavicle. You get. Okay. Division of the brachial plexus to the relation of the clavicle. Okay. The brachial plexus are divided according to the relation of the clavicle, how it lies in relation to the clavicle. You have the supraclavicular part of the brachial plexus, one, supraclavicular part of the brachial plexus, retroclavicular part of the brachial plexus, and infraclavicular part of the brachial plexus. Okay. The supraclavicular part of the brachial plexus includes the root and the trunk. That is what we call the supraclavicular part of the brachial plexus because they lie above the clavicle. The retroclavicular part of the brachial plexus includes the division. Only the division forms its retroclavicular part because it lies behind the clavicle. The infraclavicular part of the brachial plexus includes the cords and the branches because it lies inferior to the clavicle. This is how the brachial plexus is divided according to the relation of the clavicle bone. Okay. The next we'll be discussing is the roots. The roots. The roots. What is all about the root of the brachial plexus? The root of the brachial plexus is formed by the anterior or ventral primary rami of the cervical spinal nerve, particularly the lower fourth cervical spinal nerve and the first thoracic spinal nerve. So you could deduce that it is the lower fourth cervical spinal nerve and the first thoracic nerve that forms the root of the brachial plexus. So here is the roots. The roots of the brachial plexus. It is being formed by the anterior primary rami of the lower fourth cervical spinal nerve and the first thoracic spinal nerve. Okay. That is lower four cervical spinal nerves and first thoracic spinal nerve. That is all about the root. We'll move into the trunk. The trunk. Okay. The trunk of the brachial plexus is divided into three. We have the upper trunk. We have the middle trunk. We have the lower trunk. Okay. The root nerve of C5 and C6 unite to form the upper trunk. The root nerve of C5 and C6 unite to form the upper trunk. So this is the upper trunk. The upper trunk. Okay. Why the C7 only forms the middle trunk? We have our middle trunk. The middle trunk. The root value or the root nerve of C8 and T1 unite to form the lower trunk. Have our lower trunk. The lower trunk. So this is how it works. Recall that the trunk of the brachial plexus lies in the neck. It is found in the cleft between the scalenus anterior muscle behind and the scalenus medius muscle in front. That is how it is being located. Whereas the root of the brachial plexus is as well located in the neck. It lies deeply to the scalenus anterior muscle, while the trunk is located in a cleft between the scalenus anterior in front and the scalenus medius behind. That is how it works. That is how that been located in the neck region. Okay, that is all about the trunk of the brachial plexus. We have the upper trunk, the middle trunk, and the lower trunk. So we'll be discussing next is the division. The division. Division. The division of the brachial plexus is being divided according to anterior and posterior aspects of all the trunks respectively. That means the upper trunk will have the anterior and posterior division. The middle trunk will have the anterior and posterior division. The lower trunk will have the anterior and posterior division. It can be called the ventral or dorsal division. Okay. We have our divisions. Recall that this is our trunk. This is our trunk. We have anterior division and posterior division. Anterior division and posterior division. Anterior division and posterior division. So this is how it is being done, because all the trunks respectively have anterior and posterior division. Okay, so here we have our division. Divisions, trunks, roots. Okay, the next to be discussing is the chords. Recall that the division lies behind the clavicle. It can be called the retroclavicular part of the brachial plexus. We have our chords. The chords. The chords of the brachial plexus are divided into three parts. Have the lateral chord, the medial chord, and posterior chord. That's how it works. Now let's form it according to how it is being done in the structures of the brachial plexus. We have the lateral chord, the medial chord, and the posterior chord. Okay, on the lateral chord, the anterior division of the upper and the middle trunk forms the lateral chord. This is our lateral chord. The lateral chord. It means the anterior division of the upper trunk and the anterior division of the middle trunk forms the lateral chord. We have formed our lateral chord. Now on the medial chord, the anterior division of the lower trunk forms the medial chord. The medial chord. Now, on the posterior chord, the posterior division of all the three trunks forms the posterior chord. You could see the posterior division of all the three trunks forms the posterior chord. The posterior chord. So that is how it is being done. Recall that the chords of the brachial plexus lies in the axilla. Very, very important. Okay, let's dive into the next. So here is our chords. Our chords. Okay, we have the branches. The branches. We'll be starting from the branches from the roots. The branches from the roots. The first is the branches from the root. Branches from the root. The first branch from the root is a very important branch. The very important branch. Okay, we have number one, the long thoracic nerve. The long thoracic nerve can be called the nerve to serratus anterior or nerve of Bell. It has a root value of C5. It has a root value of C5, comma, C6, because it is the branches from the root. You get? It is the branches from where? From the root. It has a root value of C5, C6, and what? C7. So this is how it goes. We have our long thoracic nerve. Long thoracic nerve can be called the nerve to serratus anterior or the nerve of Bell. Clinically, the lesion of the long thoracic nerve leads to winging of the scapula. That is important to note. Okay. The second branch of nerve from the root is the dorsoscapular nerve. Dorsoscapular nerve, which have a root value of C5. The dorsoscapular nerve can be called the nerve to rhomboid. The nerve to rhomboid. It supplies to rhomboidus minor and rhomboidus major. Recall that the long thoracic nerve supplies to what? Serratus anterior muscle, while the dorsoscapular nerve supplies to rhomboidus minor and rhomboidus major. So it only arises from the C5. Okay. We have our C5. Dorsoscapular nerve. Okay. Now, apart from the nerve arising from the root, which includes the long thoracic nerve and the scapular nerve, we have other nerves that arises from the root, which includes the nerve to longus colli and the scalenus muscles, even the phrenic nerve. Okay. That means it goes this way. The nerve to longus colli supplies to longus colli muscle. Nerve to longus colli. Left longus colli, we have nerve to scalenus muscle. And phrenic nerve. But this phrenic nerve, it only arises from C5, although it's between C4 and C5. But C4 is not the major contribution of the brachial plexus. It's an associated contribution of the brachial plexus. So the phrenic nerve is only coming from the C5, C4 and C5. So it should come from the C5, the phrenic nerve. Is the motor nerve of the diaphragm. Phrenic nerve is the motor nerve of the diaphragm. It has a root value of C4 to C5. You get? Okay. These are the associated nerve that is arising from the roots. Okay. Let's dive into the branches from the trunk. Branches from the trunk arises from the upper trunk, to be precise. We have the suprascapular nerve. The suprascapular nerve. This suprascapular nerve have a root value of C5 and C6. C5 and C6. They have a root value of, because they are rising from the upper trunk, C5 and C6. It supplies to infraspinatus muscle and supraspinatus muscle. You get? Supplies to what? Infraspinatus muscle. Okay. You should go this way from the trunk. Suprascapular nerve. Suprascapular nerve supplies to infraspinatus and supraspinatus. Okay, we have the second nerve, which is called the nerve to subclavius. It supplies to subclavius muscle. The nerve to subclavius. The nerve to subclavius. Okay, those are the nerve that is arising from the trunk of the brachial plexus, particularly the upper trunk of the brachial plexus. The nerve to subclavius supplies to the subclavius muscle. So the second nerve is nerve to subclavius. Supplies to subclavius muscle. Subclavius muscle. Okay, that is how it works on this region. Okay, then we'll be going to the branches from the lateral cord. The branches from the lateral cord. Branches from the lateral cord. There are three branches that arises from the lateral cord of the brachial plexus, where we have the lateral pectoral nerve. One is lateral pectoral nerve. Two is the lateral root of the medial nerve. Lateral root of medial nerve. Three is the musculocutaneous nerve. The musculocutaneous nerve. So, the lateral cord the lateral pectoral nerve, the lateral root of the medial nerve, lateral root of medial nerve, the musculocutaneous nerve. The musculocutaneous nerve. I have a mnemonic to remember the lateral cord of the brachial plexus. The mnemonic is love of my life. LML. Love of my life. L is for lateral pectoral nerve. M is for musculocutaneous nerve. And the last L is the lateral root of the medial nerve. You get it? Now, the lateral pectoral nerve supplies to the pectoralis major muscle and minor. The lateral root of the medial nerve unites with the median root of the medial nerve to supply to the muscle in front of the anterior compartment of the forearm. That is the forearm flexors, except the flexor carpi ulnaris, which is being innervated by the ulnar nerve. Get? And the medial nerve also supplies to the muscles in the hand, such as the tenor eminence muscles. You get, it supplies to them. Okay, the musculocutaneous nerve, it supplies to the muscles in the anterior compartment of the arm, such as the coracobrachialis, the bicep brachii, and the brachialis muscle. So that is all about the lateral cord of the brachial plexus. The next we'll be looking on to is the medial cord. That is the branches from the medial cord. Branches from the medial cord. We have the medial pectoral nerve, the medial pectoral nerve. Number 2, the medial root of the median nerve, the medial root of median nerve. Number 3 is the medial cutaneous nerve of the forearm. Medial cutaneous nerve of forearm. Number 4 is the medial cutaneous nerve of the arm. Cutaneous nerve of arm. While number 5 is the ulnar nerve. The ulnar nerve. So there are 5 branches that arises from the medial cord of the brachial plexus. Okay. Now here we have the medial pectoral nerve, a medial pectoral nerve. We have the medial root of the median nerve, the medial root of the median nerve. We have the medial cutaneous nerve of the arm, medial cutaneous nerve of the forearm, medial cutaneous nerve of the arm, and ulnar nerve. And ulnar nerve. So these are the branches from the medial cord of the brachial plexus. I have a mnemonic, remember it. It is 4M minus U. For me, minus U. 4M minus U. For me, minus U. The same thing. This is the mnemonic. This one is also the mnemonic. Love of my life for the lateral cord branches. Okay. The medial pectoral nerve has a communicating branch with the lateral pectoral nerve to supply to the pectoralis major muscle and minor muscle as well. The medial root of the median nerve unites with the lateral root of the median nerve, that is the branch arising from the lateral cord, to form the median nerve, which supplies to the flexor muscles in the forearm, except the flexor carpi ulnaris, that is innervated by the ulnar nerve and the muscles of the hand. The medial cutaneous nerve of the forearm can be called the medial antebrachial cutaneous nerve of the forearm, which supplies to the skin in the medial aspect of the forearm. The medial cutaneous nerve of the arm can be called the lesser internal cutaneous nerve of the arm, or the medial brachial cutaneous nerve of the arm. It supplies a sensory innervation to the skin on the medial aspect of the arm. The ulnar nerve supplies to the muscle in front of the anterior compartment of the forearm, particularly the flexor carpi ulnaris. Although the ulnar nerve has superficial and deep branch. The superficial branch of the ulnar nerve supplies the pinky finger or the little finger and the half of the ring fingers, and it also provides sensory innervation to the skin on the medial aspect of the palm. Now, the deep branch of the ulnar nerve supplies to all the intrinsic muscles of the hand. It supplies to the medial two lumbricals. It supplies to the 7 interosseous muscles. You get? So that is how it works. Or it also supplies to the 3 hypotenuse muscles. Okay, that is all about the ulnar nerve innervation. The root value of the medial pectoral nerve to the medial root or to the medial cutaneous nerve of the arm is C8 and T1. The root value is C8 and T1. C8 and T1. C8 and T1. C8 and T1 is from the number 1 to number 4, the root value. But for ulnar nerve have C5, C8 and T1. That is the root value of the ulnar nerve. Okay, we are done from the branches of the medial cord of the brachial plexus. Let's delve into the posterior cord. Branches from the posterior cord. We have the following branches. Number 1, upper subscapular nerve, lower subscapular nerve. We have the radial nerve. We have the thoracodorsal nerve. Thoracodorsal nerve. And lastly, we have the axillary nerve. Axillary nerve. Okay. Now, this is the posterior cord. There are 5 branches from the posterior cord. 1, 2, 3, 4, 5. So we have the upper subscapular nerve, the lower subscapular nerve, the radial nerve, the thoracodorsal nerve, we have the axillary nerve. The mnemonic that you can use to remember the branches from the posterior cord is ultra. Ultra. Upper subscapular nerve, lower subscapular nerve, thoracodorsal nerve, radial nerve, and axillary nerve. Okay. The upper subscapular nerve supplies to the subscapularis muscle. It is one of those muscles that serves as a medial rotator and adductor of the humerus. You get? It supplies to the subscapularis muscle, which is the upper subscapular nerve. The lower subscapular nerve supplies to the subscapularis and the teres major muscle. You get? These muscles are the rotator cuff muscle, except the teres major muscle. It is not the rotator cuff muscle. It is only subscapularis that is the what? Rotator cuff muscle. Okay. The radial nerve is the thickest branch of the brachial plexus. It supplies to the muscles on the posterior compartment of the arm and the forearm. That is the extensor muscles. The thoracodorsal nerve can be called the nerve latissimus dorsi. It supplies to latissimus dorsi muscle that is found on the floor of the intertubercular sulcus of the humerus. Okay, the axillary nerve supplies to teres minor muscle and the deltoid muscle. So that is all about the branches from the posterior cord. So we have done justice to the structure of the brachial plexus. Okay, let's delve into let's dive into the clinical relevance. The clinical relevance. Clinical relevance. Number one is Erb's paralysis, which can be called Erb's palsy. Erb's paralysis is implicated or occur as a result of the damage to or lesion to the upper trunk of the brachial plexus where the sixth nerve meet. You get that is what that causes Erb's paralysis. It occurs as a reason or damage to the upper trunk of the brachial plexus where the sixth nerve meet. Okay, we have the standard way of writing Erb's paralysis in medical exam. Get now, I have a mnemonic for it. The first is introduction. That is what is Erb's paralysis. You get now. The next is site of occurrence. The next is cause and muscles involved or paralyzed. And the next one is deformity. The next is disability. Recall that deformity is a structural dysfunction, while disability is a functional dysfunction. So deformity is structural or is a structural disability. Why this is a functional disability or functional dysfunction per se. Okay, now the mnemonic to remember this outline writing Erb's paralysis in medical board exam is so can nerve master deformity and disability. So can nerve master deformity and disability. So can nerve master deformity and disability. You get. So that means we omitted one outline here, which is nerve involved, or the nerve root per se. Nerve root. Okay. So can nerve site of occurrence and nerve root. Okay, so is for site of occurrence, can is for causes, nerve is for nerve root, master is muscle paralyzed, deformity and disability. Now, what is Erb's paralysis? Erb's paralysis simply means the damage or lesion on the upper trunk of the brachial plexus where the sixth nerve meet. The eighth paralysis can be called the upper brachial plexus injury. The upper brachial plexus injury, which occur as a result of increase to the angle between the head and the shoulder. That is what that's how it occurs. There will be an increment in the angle between the head and the shoulder. Now, what is the site? Where does it occur? It occurs at the upper trunk of the brachial plexus where the sixth nerve meets. That is where it occurs. What are the nerve roots? The nerve root of the eighth paralysis is C5 and C6. C5 and C6. C5 and C6. That is the nerve root. Now, what is the cause? What is the cause? It is being caused, number one, by a fall from a height. And it is being caused by, number one, by a fall from a height and landing on the shoulder. It's being caused by, number one, a fall from a height. Number two, landing on the shoulder. Number three, traction of the arm. Number four, by the hyper extension of the arm. Of the neck, not the arm. What are the causes of air paralysis? Number one is a fall from a height. Number two is landing on the shoulder. Number four is traction of the arm. Number three is traction of the arm. While number four is hyper extension of the neck. That is what that causes herpes paralysis. Okay, what are the muscles involved? What are the muscles involved? The muscles include the deltoid muscle, the infraspinatus, the supraspinatus, the brachioradialis, the bicep brachii, the brachialis muscle, and the extensor carpi radialis longus muscle. Those are the muscles that are involved in the herpes paralysis, the muscles that could be paralyzed. Now, what are the deformity, which is the structural dysfunction of the herpes paralysis? Number one is policeman's steep hand, porter's steep hand, and waiter's steep hand. Those are the things that causes it. The deformity per se. The disability, there will be loss of sensory innervation. There will be what? Loss of sensory innervation on the outer aspect of the arm. There will be loss of sensory innervation on the outer aspect of the arm. That is the disability of the herpes paralysis. You get? Now, this is the diagram here. Look at the diagram used in writing as like the diagram to draw in herpes paralysis. Now here it becomes the herpes point. This region here becomes the herpes point. This is the herpes point. This is the herpes point because it includes the nerve root of C5 and C6, which has anterior and posterior division, and two nerves, suprascapular nerve and nerve subclavius. This is the herpes point where the sixth nerve meets. That is where the herpes paralysis takes place because there is a lesion to that upper trunk of the brachial plexus. Okay. Now, let's delve into the next one, which is Klumpke's paralysis. Klumpke's paralysis. Klumpke's paralysis. Okay. The Klumpke paralysis has the same outline with herpes paralysis. First is the site of the occurrence. What is the site of the occurrence? It occurs at the lower trunk of the brachial plexus. The Klumpke paralysis can be called the lower brachial plexus injury, which occur as a result of the increase in the angle between the trunk and the shoulder. So the site of the occurrence is the lower trunk of the brachial plexus. What are the nerve roots? It is C8 and T1, the nerve roots. The nerve root is C8 and T1. That's the nerve root of Klumpke's paralysis. C8 and T1 is the nerve root. What are the cause? It is being caused by the hyperabduction of the arm, or a fall from an outstretched hand. You get? Or it could be caused by when the arm is pulled on a delivery mechanism. So those are the causes. It is being caused by the hyperabduction of the arm, a fall from an outstretched hand, and when the arm is pulled away from a delivery mechanism. Okay. What are the muscles involved? The muscles paralyzed is all the intrinsic muscles of the hand. Those are the muscles that are paralyzed in Klumpke's paralysis. All the intrinsic muscles of the what? Of the hand. Get. Now on deformity, the deformity of the Klumpke's paralysis is the claw hand, because in claw hand there is a loss of flexor of the wrist and finger, because there is a lesion to the what? Ulnar nerve in claw hand. You get? So the deformity of the Klumpke's paralysis is the what? Is claw hand, whereby there is a loss of flexors of the wrist and fingers and all the intrinsic muscles of the hand, we say. Okay. The disability of Klumpke's paralysis is loss of sensory innervation to the medial border of the forearm and the hand. That is the disability. Loss of sensory innervation to the medial border of the forearm and the hand. So that is how it works. Okay, we have done justice to this and this. I've told you that on S paralysis or the abduction palsy, this is the diagram to draw from here to this region, presented this way in medical board exam. Anterior division and posterior division, C5 and C6, the two nerves and F points indicating it. Okay, the next clinical relevance we discuss is the crutch palsy. Crutch palsy occurs as a result of lesion to the radial nerve. This crutch palsy can be called Saturday night palsy or the radial nerve palsy or injury. It occurs as a result of the injury to the radial nerve. You get? It is known as the crutch palsy or Saturday night palsy per se. The next to be discussing is hip hand. Hip hand can be called hand of benediction. It is the lesion of the median nerve that results to hip hand deformity. Okay, the number 5 is wrist drop. Wrist drop occurs as a lesion to the radial nerve that brings wrist drop deformity. So it is a structural dysfunction of the wrist. Okay, the number 6 is, you can add claw hand per se, which is the lesion to the ulnar nerve. Get? Claw hand. That is how it works. Get? We'll have the next one, which is Horner syndrome. So these are the clinical dysfunction of the brachial plexus. I believe we have done justice to the anatomy of the brachial plexus from the introduction to the clinical relevances. I appreciate you for staying into this class. If you have any question, write it down on the comment section. Write it down on the comment section and endeavor to share and subscribe to my YouTube channel, which is Everything Medical. Thank you so much for watching.